Good day, class. In this video, we are going to study the applications of the 8 principles in acupuncture. The 8 principles consist of 4 pairs, yin and yang, cold and heat, interior and exterior, deficient and excess. These 4 pairs can be further categorized into yin and yang. So yin syndrome and yang syndrome. Yin syndrome includes interior, deficient, and cold. Yang syndrome includes exterior, excess, and heat syndromes. These principles are the directions of your treatments. When you identify the patient suffer from either yin syndrome or yang syndrome, then you can follow these principles. If a yin syndrome, the treatment principles will be warming the internals, tonifying the deficiency. So it depends on which situation. Yin and yang sometimes is not sufficient enough. We need to further identify is interior or exterior. Is it deficient or excess? In the yin syndrome, we can use acupuncture and Moxibustion. We can focus more on Moxibustion. We can apply acupuncture with deeper insertion and keep for a longer period. Quantifying methods, including the choices of acupoints. As we mentioned previously, some points have the nature of tonifying, such as room 4, room 6, stomach 6. We also can use the manipulation methods of reinforcing. We also can use specific applications, such as the comprehensive techniques or the combination of acupuncture and Moxibustion. In a yang syndrome, the treatment principle will be expelling the exterior, clearing the heat, purging the excess, or alleviating the excess. We can use acupuncture with shallow insertion. We keep for a shorter period, or prick for bleeding. We don't use Moxibustion in a yang syndrome. So these are the yin and yang syndrome. If we see the development from a yang syndrome to a yin syndrome, then we can conclude that this disease becomes worse. If we see the condition develop from a yin syndrome to a yang syndrome, then we can conclude that the patient is recovering. And this yin and yang also can refer to the excess or deficiency. The exterior and interior syndromes. Firstly, we need to understand what kinds of manifestations are considered as exterior syndromes. From the terms of exterior and interior, the exterior syndrome refers to the superficial level, the superficial skin, and because of the lung is in charge of the superficial skin. So from the relationship between the body constituents and the internal organs, the lung is linked to the superficial skin. Because the pathogen attack the superficial skin, so the presentations will mainly focus on the lungs. So this patient may present with chills, fever, headache, body ache, but all superficial, or the upper part of the body. The patient may present as nasal obstruction, sneezing, runny nose, coughing, tachypnea. You see, all these are related to the lung, the zang. the 脏腑 organ of the lung, as it described in 灵枢. It refers to the lung system, which includes the nose and the throats, and also the pipes. The scratching is the sensation on the skin, also superficial level. The skin also in charge of the lung. So the anterior surgeon mainly focus on the superficial skin, superficial muscles, and the lung. The patient may present as pale red tongue with film coating. The coating must be firm, so this is very important. If the coating becomes thick, this is not a superficial syndrome. The pulse will be superficial pulse or floating pulse. Floating pulse, so sometimes it is very difficult to study the pulse. When you have the chance, if you see some friends or your families got flu, then you're going to feel the pulse. In most conditions, at that stage, the patient may present as floating pulse, especially at the beginning of the flu, so the first few days. And you need to confirm from the tongue, a film coating. So the film coating is very important to diagnose the anterior syndrome. The treatment principles will be smooth and unblock the meridians, expel the anterior pathogens. When we say the anterior pathogens, it can be the wind, it can be the coldness, it also can be the heat, even the dampness. A patient suffers from anterior dampness, anterior coldness, and wind and heat. The patient may have all different kinds of manifestations. So we need to use other diagnostic approaches to help us to identify the pathogens. But just in general, no matter what kinds of pathogens, we can use the following. No matter what kinds of pathogens, we can choose from the following points, such as Du14, large intestine 4, large intestine 11, 三焦 5, lung 7, GB20, bladder 12, bladder 13, etc. Du14 we have mentioned quite a few times. The Du14 is the meeting of the yang meridian, the yang qi. So on the back on the Du meridian, it is very important to clear the heat. Large intestine 4 can activate the circulation, expel the wind. Large intestine 11. These are all very commonly to be used to relieve the anterior. We can use the lung 7 from the poem. Anything related to the neck and the head, we're going to focus on the lung 7. So this is principle you need to memorize. Anything related to the neck or the head, we're going to focus on the lung 7. We may apply different techniques when we discuss this kind of diseases. We will introduce different technique on lung 7. This is a very important point for something related to the head or the neck. GB20, 风池, gallbladder. We have introduced the Chinese name, so only a few points we introduce the Chinese name because it is very meaningful. 风 means the wind. 池 is the pool of the wind, which means the wind gathers in on these points. We can use this point to expel the wind. Bladder 12, 风门. Feng, when you see feng, that's the wind. Meng is the gate. That's where the gate of the wind. So these going to can help you to treat the wind. Fei Shu, bladder 13. Fei is the lung, Shu is the back Shu point. So we're going to focus on the organ, the wind, and some other points which can help to reduce the heat or relieve the superficial pathogens. From these different points, we may use different techniques: insertion with the filiform needles, prick for bleeding, Moxibustion, reinforcing technique, or reducing technique. So we're going to apply different techniques. Even on some points, we can use lifting and thrusting or rotating. You may choose different technique according to the individual conditions. Different patients present with the anterior syndrome, but accompanied with other different symptoms and syndromes. Then we may use similar points, but very different technique. For example, a patient suffers from anterior coldness or anterior deficiency. Anterior deficiency, the patient may present as spontaneous sweating, may present with fever and spontaneous sweating. Anterior coldness, the patient may present as fever, aversion to cold, and also accompanied with other symptoms related to the lung. So all the anterior symptoms we have mentioned in the previous slides may happen in these anterior coldness or anterior deficiency. In this situation, we can use the combination of acupuncture and moxibustion. We can use tonifying and purging methods. It depends. So these two are very different, tonifying and purging. It all depends which one is dominant. Anterior coldness, the pathogen, it is considered as the excess compared with the deficiency. Anterior deficiency, we're going to tonify the anterior. So you may choose either tonifying or purging methods according to the different symptoms. For anterior deficiency, we may use moxibustion. For example, we can use moxibustion on GP20 to 14. For anterior coldness, we can use acupuncture to keep for a longer period, shallow insertion. We also can use the bladder 12, the 肺腧. The anterior heat or anterior excess, purging method, we use acupuncture with shallow insertion, keep for a short period. Because of its heat, so we will never use moxibustion. The interior syndrome, as we mentioned previously in the diagnostics, an interior syndrome consists of various signs and symptoms. When we say interior, rather we say it is not exterior. So anything non-exterior, it is considered as interior. The patient may present with all different kinds of symptoms. The treatment principles will be activating the qi and blood, recovering the zangfu organs, the function of the zangfu organs. We may use Rong 12, Stammer 25, Spleen 15, Sanjiao 6, Stammer 40, Rong 6, Rong 4, Stammer 36, Spleen 6, Stammer 37, Stomach 39, Rong 4, Rong 12, Zong 1. This is the meeting points of the Fu organs. Stomach 25, we have mentioned previously. This is very important. For the interior syndrome, depends on the excess or deficiency. For excess, we will use needling technique. For deficiency, we can use moxibustion. These points can be used to activate the qi and blood circulation. It also can be used to tonify the qi. So we said it can be used for bleeding or amenorrhea. It can be used for excess bleeding or amenorrhea. Spleen 15, Sanjiao 6, Stomach 40. We also have mentioned at this point it's very good at clearing phlegm. No matter what kind of phlegm, the physical phlegm that we can see from the lung, or the invisible phlegm, which means the different pathogen or causes of all kinds of diseases, especially the strange diseases, such as the mental disorder. Room 6 and room 4. These 2 points are very important to improve the antipathogenic qi. So we will use Moxibustion on room 6 and room 4. Stomach 36 on the stomach meridian, as he described in the principles. Anything related to the abdomen and the stomach, we can use stomach 36. Spleen 6, 3 in meridian, 3 foot in meridian meets at the spleen 6. Stomach 37, stomach 39. This is the low C points of the stomach, and the low C points of the large intestine and small intestine. As you can see, all these points, either they have the nature of tonifying, or they related to specific organs. They more link to specific organs. The links made from the low C points, the connecting points, the yuan source points, the front mu points, or back shu points, all these connections are basically from the specific, more based on the special points that we have studied in acupuncture and Moxibustion. Again, for interior syndromes, it also depends on the situation. We may use different techniques. Interior coldness, interior deficiency. We will use acupuncture and Moxibustion. We can use tonifying methods with less forceful manipulation. Focus on Moxibustion because these are coldness and deficiency, so we can use Moxibustion. Interior coldness. Interior, we will keep for a longer period. Deep insertion because of interior. We can tonify or purging depends on the combination of the pathogens. We also can use the warming needling technique. Can you warm the middle jaw? How to warm the middle jaw? You can use room 12 as the full meeting points. Also, the room 12 locates in the middle jaw. Interior heat purging method. Acupuncture with deep insertion, reducing method. No Moxibustion. As you can see here, we always mention no matter exterior or interior heat, there will be no Moxibustion. This is also aligned with the function of the Moxibustion to increase the heat, to increase the yang qi of the body. So this principle is essential as indicated from Huangdi Neijing. In our treatment, we should not reduce the deficiency. We should not tonify the excess deficiency. We should not reduce purging. We should not reduce the deficiency. For excess, we should not tonify. We should not tonify the excess. That's why we don't use Moxibustion. Moxibustion is more likely to create a heat, to tonify. That's the characteristics of this technique. When talking about cold syndrome, the patient may present as all different kinds of cold sensations. The cold sensation can be superficial, also can be internal. Internal mainly focus on the spleen and the kidney, although also can be other organs. When you memorize the symptoms of these cold syndromes, you need to think about where they are, which organs have been affected. So you can try to memorize these symptoms from the organs. For example, firstly, the cold syndromes. The patient must present with cold manifestations, cold lumps, aversion to cold, cold intolerance, preference for warmth. So that's the characteristic of coldness. The patient also may present as cold pain. And then if the coldness affects the spleen, the patient may present as tastelessness, accents of thirst. The patient may present as loose stool. The patient may present as profuse urination if the coldness in the stomach, in the spleen, in the small intestine, or in the bladder. So the patient may present a clear, perfume urine. The loose stool also can even be diarrhea. The nasal mucus or saliva. The nasal mucus must be clear and thin. That's why thin, clear phlegm and nasal mucus. The saliva can be profuse saliva, clear saliva, curled up rising position. That's because the pain or the coldness is a kind of in pathogen. So the patient will curl up. Pale complexion, also coldness. Pale tongue, white, moist or white slippery coating. Pulse tense or slow. Why the tongue can be moist or slippery? This is because the coldness may result in water retention in the body. The coldness does not consume body fluid, so the patient may present excess water retention. When it presents on the tongue, you can see the moisture or slippery tongue. Due to coldness, the patient may present as pain or numbness in the muscles, so that's body ache. In this situation, we can use the Moxibustion. We also can use the skin needling technique or cupping because these are on the superficial level of the skin. Internal coldness, we can use acupuncture with deep insertion, keep for longer periods, and even warming acupuncture technique. For instance, a patient suffers from spleen and stomach deficiency. So in this situation, the patient may present as all the symptoms that we have mentioned in the above paragraph. The patient also may present as poor appetite, loose stool, diarrhea, or indigestive food in the stool. No matter what kind of manifestations, as long as you diagnose this patient suffers from spleen and stomach deficiency, we can use Room 12, Bladder 20, Bladder 21, Stomach 36, Spleen 6. We can use acupuncture and Moxibustion. More focus on Moxibustion, reinforcing manipulation technique. Zone 1, the Fu meeting points. Pi Shu, Bladder 20, Pi is the spleen transporting points. Bladder 21, the stomach transporting points. Wei Shu. Stomach 36 can be used to tonify the spleen and stomach. Spleen 6 on the spleen meridian. So in future, in your test, or whenever we mention the prescriptions, in your treatments, even if in future in your treatments, when you prescribe the points, you need to explain the reason why you choose the points. Especially in your tests, in future, if you use the points that's not in your textbook or not in the notes, if you explain well from the theory, you can get the marks because that's the facts that you can use. If you can explain well from the theory that you can use. But it is very important that you have some theories to support your treatments. For example, in this situation, you won't choose bladder 12 because bladder 12 is more focusing on the lung. You use bladder 20. You won't use the large intestine 4 because that's more for reducing. This patient suffers from deficiency. So we will use stomach 36. We can use acupuncture with deep insertion. We also can combine with Moxibustion on stomach 36. We can use the Moxibustion only. We can use the combination of acupuncture and Moxibustion on all these points. You may use some of them. You also may use all of them. But when you use all of them, you also need to consider the convenience, because some points are in the front, some points are on the back. So in which position, if you choose all of them, in which position you want the patient to sit or to lie? So that's something you need to consider in your treatment. So that's something you need to consider when prescribing the acupoints in your prescriptions. In this video, we mainly discuss the yin and yang syndromes and the cold syndrome. In the next video, we are going to continue the discussion on the clinical application of the 8 principles. Thank you for your attention.